I was diagnosed, it was either in late August or early September of 2010. I had persistent chest pain for 4 or 5 days, and that led me to go to the doctor to get it checked out to make sure it wasn't any heart problems. I have significant heart problems running in my family, so I wanted to make sure that wasn't an issue. And I got a clean bill of health that day, and I was just told that it was probably muscle cramps or muscle strains or maybe a rib out of place. And it wasn't for a week and a half that I got a call from the same urgent care facility that they'd found something abnormal in my chest, and that's what led me down the entire path of diagnosis.
Overall, germ cell tumors of the testicle are fairly rare. There'll be about 8,000 cases in North America this year compared to 200,000 plus cases of prostate cancer, for example. So it's relatively uncommon overall, but in the 15 to 35-year-old male age group, it's the most common malignancy. And so since it's highly curable and those patients have a large number of productive years after cure, it has a huge impact in treating it correctly. So in patients who have it clinically confined at the testicle, there are a number of options after removal of the testicle surgically, and that depends on the type of testicular cancer. That might be radiation therapy, it might be surgery to remove abdominal lymph nodes, it might be just surveillance and then chemotherapy for the percentage of patients who are destined to have it recur. When it's moved visibly outside of the testicle by CAT scan or physical examination, that requires chemotherapy. And those patients that have relatively small volume disease, the cure rate can be in excess of 95%. Even in people that have far advanced disease, the cure rate is still nearly 50% with chemotherapy.
Dr. Roth said the first course always for testicular is chemotherapy, and that's what we started with. And now he's just monitoring the size of what's left. There's still some residual mass, I suppose, in my chest. I don't want to call it a tumor. But there's still something there, and he's just monitoring to see if we can just leave it and call it dead, or if at some point I have to have surgery to take it out or not. So my advice to my friends now and to everybody else is, if you have something legitimately wrong, if you've got pain for a couple of days that won't go away, or something is truly bothering you, don't just shake it off. Go get it checked out. It's probably nothing, but I thought I probably had nothing going on with me, and next thing I know, I was diagnosed with cancer. A lot of young men, or a lot of men in general, are kind of embarrassed when it comes to talking about testicular cancer and their manhood, so to speak, but there's nothing to be embarrassed about. I learned that very quickly.
Just raising the level of awareness to prove to individuals that yes, you can get cancer. Cancer is not something that only 65-year-old smokers get, and that if caught early, then certainly the trauma of therapy can be minimized. So I think just to say this can happen to you, if you notice something abnormal, then seek some medical attention and tell a significant other that there's a problem.